Okay, so I want to go over a test that I received. I have a 42-year-old female, 180 pounds, BMI of a 30.7, waistline of a 28, and she's 5'6". This patient has been on a GLP-1 medication, tirzepatide. She's getting closer to reaching her goal. And of course, I suggest, well, let's get your hormones tested, because weight loss is really not just the success of it is not independent of hormone testing. So we go deeper because she's complaining of certain things, right? So this is a saliva test result that I just got back. So this is a patient, she has memory lapses, mood swings, her muscle size decreased, her nails are breaking. She's a little nervous, has some night sweats, a little OCD. I don't know if anyone can relate to this. She's having sleep disturbances. Her stamina has decreased. She's stressed out, sugar cravings, complains of swelling eyes, puffy eyes, and weight gain around the hips and waist, and urinary urges. So we get the results back, and of course, it's the whole cascade of hormones that we're looking at, right? And so her estrogen level seems to be pretty good in the luteal phase. When we're looking at like day 14 to 25 of your cycle, this is a very important time. This is where we like to test to see if there are any hormone imbalances. Sometimes in general practitioners, they'll test any time of the month. But to get really accurate numbers, the best time to test is from day 14 to 25. So day 14, day 1 is the day that you actually start your menstrual cycle. Here, the patient has low progesterone. And progesterone is probably what at this point is affecting her sleep. So that's something that, we want to correct. Another thing that she's having is low testosterone. So this is creating her low libido, a little bit of vaginal dryness, some fatigue. It can create memory loss and some depression and muscle and bone loss. So we don't want to give too much testosterone because you can get a little bit of hair thinning, but you definitely want to address that low T. I'm really picky about the testosterone because it affects women's sexual drive and ultimately affects their relationships, right? So we want to stay on top of that. Here, the patient also has some low DHEA. So we want to also correct that because that also helps our testosterone levels. And here it totally looks like her adrenals are blown out. So it makes sense probably why she's gained weight and having issues with weight maintenance, because maybe she has a lot of stress in her life. Maybe she's working 12-hour night shifts. Maybe there's been a loss in the family. Maybe she just had two or three children. Our stressors come in different ways and it affects our adrenal glands. So correcting our cortisol levels are very important here. It looks like her melatonin levels are slightly higher than normal, and correction is also needed here. So in this case, we would consider maybe using some progesterone, a little bit of testosterone. We'll also add some adaptogens like ashwagandha to help with her cortisol levels, support her with some DHEA, and also make sure that she's on a really great multivitamin. But this is a perfect case, and I think that a lot of women have these symptoms, and I feel like a test is warranted.